Dr. Fuhrman, I want to thank you for joining us. We wanted to discuss mental health and nutrition, the impact a nutritarian lifestyle will have on mental health. But I also had a few questions regarding the coronavirus, the recent pandemic in the U.S., and I wanted to encourage my audience out there to watch your video. I really enjoyed your video because it spoke the truth about, you know, people don't have to be afraid of this virus. And yeah, I just wanted to thank you first for putting that message out there.
You're welcome. And of course, I mean, we all know that most people in America die prematurely of things that are preventable, like heart attacks and strokes and cancers, which are all largely preventable. And, the same dietary excellence that enables people not to have a heart attack and not to have a stroke supports, and not to get cancer, by the way, supports normal immunity and makes our body powerfully protective against viruses, because that's what our body's designed to do. It's designed to prevent viral replication, remove virons, and isolate them quickly before they can replicate and change their DNA, change their RNA, excuse me, to become pathogenic and invade tissues. So in other words, what we notice in this pandemic is that the healthiest people are not hurt by this. The most unhealthy people are hurt. So nobody's talking about what people can do to become healthier, so they're not going to be vulnerable to these viruses. The biggest, it doesn't kill everybody. It's not killing everybody, that's for sure. It's killing, you have the highest probability of death in the most unhealthy people who might have died anyway of something else in the same year, because they're putting themselves at high risk of death, either because they smoke or they eat fast foods or commercial baked goods or sweets or oils and fried foods, whatever it is they're doing, or too much, they're eating a diet that's not healthy, and they have health, and they developed health medical problems, and they're sickly. So sickly people are going to be at increased risk of death when they get sick. And what we have to teach people is how they can not be sickly. And if they do have a medical condition, they should be reversing it as urgently as possible. If you're diabetic, get rid of your diabetes in the next month. This approach works. If you have high blood pressure, get rid of it right away. Eat right and stop salting your food and eating oil, and start eat the right foods and get rid of your high blood pressure. If you're overweight, let's see, either start to lose weight at least 10 pounds this month if you're overweight. And then next month, get down to it, lose at least 2 pounds a week. Start to get healthy. And if you're not doing that, then you're irresponsible. If you're not going to eat right, then you're irresponsible. Then you're just saying, come and get me.
Yeah, that's really, really well said. I thought of another question as you were speaking as well, because I know that COVID-19 is a virus like the common cold, and I feel like, and I don't know if you believe this is true, that the colds are they don't last as long. I notice as I'm a nutritarian. I used to get colds that would last a couple weeks, and I'm wondering if you could speak about that, how this protects against the cold too. Do you notice in other patients that it goes away quicker, or they have less severe symptoms?
Of course. I wrote a book on it called Superimmunity, and I even discussed the science via which how viruses spread in the body, and how a simple virus can cause serious problems when nutritional deficiencies are present. And now's the time for people to fix their problems they have. I've been screaming this from the rooftops for 30 years, that why sit around waiting till your first heart attack occurs? 40% of people that have a heart attack are dead on the spot with their first heart attack and don't even make it to the hospital alive.
Wow.
You're going to wait for that? And now, but for some reason, because it happens so suddenly and everybody's getting it, nobody seems to be concerned about that, even though there's almost, about 1,700 to 2,000 deaths every day from heart attacks. Why aren't people concerned about that? Every heart attack death is a needless death. People don't have to die of heart disease. They can eat right and not die. And, now more than ever, the nutritarian diet, which is the pinnacle or the gold standard of nutritional excellence to protect the body, people don't like that. They're like, it's not what they want to hear. They want a different answer. They want to be able to eat their pizza and donuts and cookies and French fries and burgers or whatever it is they're eating. They want to eat those foods and not get cancer and not have heart attacks, not get breast cancer and prostate cancer, and be able to eat those foods and still not be sick, be seriously ill when they get a coronavirus. But life is not a fairy tale. Your body behaves from the way you fed it. And if you eat the foods other Americans eat, you're going to develop those degree of risks. And if you want not to have that risk, you don't have to. You just got to eat right. And so this is a time not to compromise on nutritional excellence. This is the time to, maybe there's a silver lining in this. Maybe the silver lining is people will wake up to the fact that they can't keep themselves in such bad health and expect not to be at high risk.
Right.
If you get what you pay for.
Yep. I'll have to check out your book, Super Immunity. That's the one book I haven't read yet, but now's a great time to start reading that with what's going on.
Well, my most recent book, Eat for Life, also has the same basic information. It's not as focused. It's more focused on all the diseases like diabetes and getting well from autoimmune conditions and preventing cancer and improving your immunity, whereas Super Immunity just focuses more laser-like in that book on infection and cancer and autoimmune disease. It doesn't talk about diabetes and heart disease as much. Right. So my most recent book, Eat for Life, is also a great book for people to read to understand this program in depth and to begin adopting it immediately. They can download they can get an Audible version or download a PDF, the kind that comes right off to your computer immediately, instantaneously. You can get one of those downloadable versions. You don't have to wait till it's mailed to you, and they could start reading it.
Yeah, that's what I did. I listened in the car on the way to work when I was working. Now I'm working from home.
You got the Audible version. You listen to so they can start studying this information, because what I'm saying is that the evidence is overwhelming, and that irrefutable, overwhelming evidence, and they should go through that to see if this makes logical sense to them and if the evidence is convincing. And what I'm saying is that most people looking at this information may say, oh, I wouldn't want to eat that healthfully.
Yeah, I've heard that too. Yeah.
I'd rather enjoy my life more and eat what I feel like eating. But I'm also showing people how incredibly delicious you can make this taste with great recipes. And it does take a little time to adopt your taste buds to it, because your taste buds get stronger. But anything in life that gives you tremendous benefits and reward has some effort. And the effort is in the first few weeks, adapting the recipes and adjusting your taste buds, and then you learn to love eating this way. It's just incredibly foolish and irresponsible not to, because when you get sick, you don't just hurt yourself. You hurt other people, and you make other people have to care for you. You make your family, when you go into a nursing home after a stroke and can't care for yourself, you've just you just hurt your children too, because now they've got to revolve their life around meeting your needs because you can't care for yourselves anymore. Yeah. What I'm saying is, when you don't care for your own health, you're not just hurting yourself, you're selfishly hurting other people too.
Mm-hmm. Definitely. All right, I want to turn over to Rob, because he has some questions regarding mental health and adapting a nutritarian lifestyle, because he had depression himself and he was able to overcome it with this lifestyle. So Rob, I know you had a few questions for the doctor.
Yeah, and Dr. Fuhrman, I have your book also, Eat for Life. I'm excited to read it. I have several of your books as well, and like Rich said, I have overcome depression and anxiety with the nutritarian lifestyle, so we're so grateful for your work and what you're doing. And I know you've touched on this a little bit, but as far as the impact on our mental health, the toxic Western diet and nutritional deficiencies, they kind of go hand in hand, correct?
That's right. They're intertwined like the fibers of a cloth, because the American diet is nutritionally deficient in antioxidants and phytochemicals. We need not just a high amount of phytochemicals, but we need a diversity of different types of phytochemicals to actively and ideally arm the immune system. And the brain's function, too, is dependent on reducing the toxicity, the reactive oxygen species that are caused by the lack of antioxidants and phytochemicals in the diet. So when you eat the American diet, which is 60% of calories from processed foods, like pasta and bread and salad oils, and 30% or more from animal products, that means most of what you're eating, almost everything you're eating, has no phytochemicals and antioxidants. So that's going to lead to depression and dementia when you get older. There's a solid relationship between commercial baked goods, eating flour and sugar products, and fast food with depression. So much so that even 2 servings a week has been shown to double a person's risk of developing depression, 50% increased risk of lifetime depression, and it goes up from 50% to higher levels based on higher amounts. And those people who are not depressed still are dysthymic. They still have lower emotional positivity. What I'm saying right now is that the American diet floods the body with brain toxins and also doesn't supply the nutrients we need for normal brain function or normal immune function. And that 100 years ago, 1 in 100 Americans were mentally ill. And today it's 1 in 5.
Wow.
And so, yeah, and nobody's talking about the effect of what we eat on depression and dementia and anger and loss of brain function and loss of learning capacity. And we're just destroying our brains, not just destroying our bodies. When you have diabetes, you didn't just destroy your body, you destroyed your brain. And you are weakening your brain. You have increased risk of depression with diabetes and obesity. There's more risk of depression and more risk of cancer. What I'm saying right now is that, of course, there's no such thing as a healthy overweight person. Fat cells spew out inflammatory compounds, and they excite aromatase, which produces more estrogen. And the higher levels of estrogen increase the risk of breast and prostate cancer, and they make you insulin resistant, which then makes more spikes of glucose after a carbohydrate load, and the higher insulin and higher glucose in the blood increases risk of depression and increases risk of dementia and causes brain cell loss and brain cell damage.
Right, and the how soon? I know you've touched on this also. Someone might start noticing some benefits with the Eat to Live Nutritarian lifestyle fairly soon, right, Dr. Fuhrman?
Yes, fairly soon. Within, we're saying within a month, or certainly within 2 to 6 weeks, we start to see improvement. And because I want people to improve and not to require, medications if possible, because the chronic use of medication can cause you to require lower levels of serotonin sensitivity, requiring serotonin uptake inhibition for life. It could make you more prone to depression after many years of taking those drugs. So we try to do it without medications, and we give people, sometimes we're flexible to utilize things to do what's needed for people, but most people get better quickly. And we, of course, add to them fish oil, high EPA fish oil, and we give them, making sure their supplemental regimen is right, so there's no B12 or D or zinc deficiencies. And then we give them usually SAMe and some saffron and 5-HTP, occasional tryptophan. We give them some things to help that speed things along. And, of course, the right sleep and wake cycles, the right exposure to light. There's so many things naturally we do for the protocol to help people make a complete recovery so they don't get addicted to these medications and hurt themselves on drugs or adopt a drug-only approach. If drugs are not effective because people are still deficient in nutrients, the brain's still deficient, and you're relying on drugs. It's like relying on drugs for diabetes or high blood pressure or heart disease. Drugs become enablers. They make things worse because they allow people to think that the answer's in the drug, and they don't do anything else to fix the problems that caused the issue to begin with. So it's very hard to fix a problem when you're still incurring the same causes. It's like hitting yourself with a hammer every day and taking a drug to relieve the pain while you give yourself another smack the next day. You got to remove cause, and cause is mostly what people put in their mouth.
Yes. Thank you, Dr. Fuhrman. Richard, I think you had a few more questions for Dr. Fuhrman also.
Yeah, I had a question again about the COVID-19 thing. A lot of people are in isolation right now, and the social distancing, and it could be very depressing and cause a lot of anxiety. What do you suggest for people who are going through this, getting depressed because of it?
Well, I've been advocating for 30 years that people stop worrying about dying of heart attacks and strokes and cancers. I mean, even the fear of getting cancer, even the fear of going in for a mammogram is hurtful for people's well-being and long-term health, because fear is not good for your health.
Right.
And what I'm saying is that the best aspect, one of the important aspects of nutritarian living, is that you lose the fear and you feel confident in your body's ability to protect itself. You stop getting sick. Viruses don't bother you. You stop having to get sick with a cold or a flu. You could be well the next day. You're better in a day or two. Your sicknesses, you feel you don't have high blood pressure. Your cholesterol comes back to normal. Your diabetes melts away. Your weight stays favorable for the rest of your life. And of course, you feel better and you're more confident. And what I'm saying right now is that this COVID-19 virus is dangerous for people who are unhealthy, who have medical problems that they could get rid of through the proper nutrition. And the Nutritarian diet is the gold standard or pinnacle of nutritional excellence, gives people the opportunity to get back their health as fast as possible, to get their blood pressure back to normal, to get rid of their diabetes, not to treat it, not to control it, but get rid of their diabetes quickly. Usually within a month, they're non-diabetic. And within a short period of time, we can improve their immune system and get them feel that they're protected against this virus that affects and is harmful and dangerous for the most sickly people. Get rid of your sicknesses. People stay sick. They keep going to doctors and taking drugs, and they stay sick because they don't change their diet. Get rid of your illness. And if you're overweight, start today losing weight. Start eating you're making your lunch a giant salad with some beans on top and a nut-based dressing, one of my nut-based dressings, and a bowl of vegetable and bean soup and a piece of fruit for dessert. And start eating right, get the salt and oil out of your diet. Learn this approach because it remarkably and predictably has people normalizes their blood pressure and gets rid of their diabetes and gets rid of their heart disease. They get off the drugs, get well, and it can fix their immune system and protect the brain from dementia. And the side effect is you won't be risk from being killed from coronavirus.
Right.
In other words, it'll give you dramatic protection. Nothing can give you this degree of protection. Sure, we shouldn't, be in public touching public surface and putting our hands to our face. But that's not enough because people are still going to be exposed, and we have to protect the host. And of course, any infection is more dangerous when you have exposed to a large number of virons. The viron is more pathogenic, and the host is in poor health. And so we want to reduce our exposure to large amount of bacteria by keeping our hands away from our face and keeping our hands clean and not being in exposed surfaces. And that's not you want to reduce the load of the exposure. It's the viral load that makes it more contagious. So this may be a pathogenic bacteria, but that's only one part of it. It's not pathogenic in healthy people. Healthy people can knock this out pretty quickly. So it's reduce your viral load by proper precautions, and then improve your immune system and develop super immunity by eating G-bombs every single day.
Exactly.
Eat your greens, beans, onions, mushrooms, berries, and seeds, and take the supplemental regimen I'm recommending people to take. And I even, as you know, I even recommend people take the mushroom extracts, the mixed mushroom extracts mixed in with the astragalus and beta-glucan, or you can use the mushroom. I have a chia mushroom tea they can use. But with the Nutritarian diet and with the moderate use of supplementation to make sure they're not vitamin D deficient or B12 deficient or zinc deficient or iodine deficient, we just want to make sure people are not walking around with deficiencies.
Right. I have a feeling, I think I know your answer for this one, but in the news they've been talking about vitamin C, how giving people vitamin C through the IV is making improvements, but why not just eat the vitamin C daily?
Right.
What are your thoughts on that?
It's like telling a person who has lung cancer that they should don't quit smoking now, wait till you get lung cancer and then quit smoking. In other words, wait till a person gets so sick so they need IV treatment and it helps maybe a little bit. Right. No, you get what I'm saying right now is vitamin C, IV or not, is not as effective as the wide rainbow or symphony of nutrients you get from natural foods. Vitamin C drip isn't going to give people 1/10 the benefits of eating a healthy diet. It's maybe not as bad as staying vitamin C deficient on your poor diet, but we can't give everybody vitamin C drips. It's ridiculous anyway. Right. And that's just more reason they think, I'm taking a vitamin C drip. They don't have to eat their salad and their berries. No, the vitamin C drip is not 1/10 as protected as eating your mushrooms and your berries and your green vegetables and all the things I want people to eat. So no, again, protect yourself right now. Don't wait till you get sick and then try to rush for some extraordinary invasive type treatment like IV vitamins or something. It's just total insanity. It shows their cure mentality, their treatment mentality, thinking that doctors are going to save them instead of taking their health into their own hands in their own homes and protecting themselves with the healthiest diet possible.
Right.
The emphasis is on the wrong syllable.
Yeah, I completely agree. I had a feeling that would be your answer too, because it's the most logical, of course.
Right.
Eat your veggies and fruits. Absolutely. Rob, I'm sure you have other questions.
Yeah, and are there certain foods that contribute to mental health deterioration, such as anxiety and depression, more than others?
Yes, definitely. The foods are commercial baked goods, foods made with white flour and sugar and oil, and also foods that are fried or cooked in fast food restaurants where you overheat and overcook foods. So it's the combination of fast food and commercial baked goods that have the most, and fried foods that heighten the risk of brain damage and depression. Absolutely. And it's funny because when people come into my retreat, and they usually go there because they're food addicts and they have diabetes or high blood pressure or heart disease, and they stay for a couple of months. They don't come in because they're depressed. They come in because they're overweight and sick. But what the effect happens is when they come there, they're irritable and easily angered, and they're dysthymic, like most Americans are dysthymic, which means they're not feeling good about their life. They'll have a mild depression or lack of enthusiasm about life. And what we see there as people make these changes and lose the weight and eat the healthy foods, we see that their personalities change. They always say the fog in my brain is lifted. They start to think more clearly, get more excited about life, become more creative, and now start to develop gratitude, not just gratitude for the beauty of their earth and their life, but they start to be grateful for the food even. They start to appreciate the scientific, miraculous healing powers that food imparts into our body and how these foods have been designed for our body to utilize them. And they start to appreciate the people that cook the food and picked the food and seeded the food and the farmers that made the food. And the fact that we have, when I eat like wild blueberries, by the way, are a superfood. They're like incredibly protective against dementia and cancer and immune function. And I'm thinking like amount of workers and labor, the hours of labor that had to go into to pick those little tiny berries to make a whole cup of berries for us to eat frozen. You know what I mean? Our ancestors didn't have this possibility of eating a diet this good with so much variety of healthy foods. They couldn't get sprouts and microgreens and baby green vegetables in the wintertime and frozen berries and stuff like that all year round. I mean, and different varieties of mushrooms. And we have such an unprecedented opportunity to be in great health that nobody's taking advantage of.
Right.
Yes. And I've noticed with my own mental health and well-being, I suffered from depression all my life, and the Nutritarian lifestyle has completely changed me as a person. I feel better than I ever have. Dr. Fuhrman, so thank you. Dr. Fuhrman, are you seeing that in the mental health facilities, they are starting to adopt either your diet or becoming more aware of a diet in general in relation to mental health? Is that starting to happen?
No, not at all. It's the lack of that is dangerous. But what I'm seeing is we're starting to see penetration of nutrition into the cardiovascular community. We're starting to see doctors and cardiologists at least discussing it. That's been more prevalent. We're starting to see just the beginning of oncologists and cancer specialists start to discuss nutrition. It's the tiniest bit. But in the field of mental health, I don't think it's seen hardly at all. The reliance on drugs is overwhelmingly improper, and there's no foundation of giving people the right type of nutrients for proper brain function. And as you can see from in the media, how much you're seeing on the air today, are we seeing the proper nutrition to protect ourselves against coronavirus?
Never.
And the fact that people, nothing about it. It's just about, they talk about how diabetics and people with heart disease and lung problems and smokers are at increased risk, but nothing about the fact how you can improve your health, lower your blood pressure, become non-diabetic, improve your immune system, reduce the risk of infection, and reduce your risk of death with healthy eating. Nothing, zero about it practically.
Yeah. It's really an injustice to the people. I mean, they should know the facts about it and how to heal themselves. Especially, since the hospitals are going to be overwhelmed, and it's important for people to make changes now to improve
right,
their
and
health.
we're talking all about how to make the hospitals and flatten the curve and get more equipment for sick people. And it was the same thing we do with other diseases. We're talking about how to make it so people can afford being sick and how we can care for all the sick. And nobody's talking about how to prevent people from being sick to begin with.
Exactly.
And stop. We can stop all this in its tracks if people would change the way they ate. And of course, that's my message, and I want people to get out there and study this information and adopt it. It's fun, and it gives you hope, and it gives you the power to control your health and your health destiny, and it removes your fear and anxiety about having no control. You have control, and this is a fun way to get control because it controls almost all diseases simultaneously, and and it works ubiquitously across the board.
It does. It does. I have to say personally, and I'm sure you've heard this from other patients, that I never knew I was depressed until after I lost the weight. And looking back, I feel like I was in a state of depression and didn't even realize it. I probably was dysthymic, as you're talking about.
Right. Everybody treated loses the weight. They feel the same. They start to feel much better. They felt emotionally, and they've described the same thing that you were saying. How much weight did you lose again?
It was 150 pounds.
That's really, yeah, I know. I'm so proud of you, and you're such a great role model for people. So fantastic.
And I've lost 60, Dr. Joel Fuhrman, too.
Wow, that's fantastic. And it's so different from other people who've lost weight because you've done it in a healthy manner. And you keep it off because you learn that this is not something you're living this way, and you're going to continue to live this way because the benefits are so overwhelming not to give up.
Yeah, I have to say, some people will say to me, I have willpower to steal. But to me, it's not about willpower because I'm not craving those other foods. That's what people don't understand is the cravings stop for the junk.
And we love what we eat, and we love these recipes, and it's still delicious food.
Exactly.
Yeah.
So how's it willpower steal when you're craving it? You're craving the healthy stuff.
Yeah, when you're an addict, when you're a junk food addict and you're overweight, that takes nerves of steel. Once you learn this way of doing things and you accomplished it, it doesn't take nerves of steel anymore. You enjoy your life more.
Very good point. Yeah.
Yeah, and I've found, like so many people, that at first it can be a little bit challenging to adapt, but once you get this, and now I love eating this way. It's exciting and it's fun every day.
Yeah, and that's what we got to do. We have to get America on board with this, and so that's where we were going to stop all these needless deaths. Still, don't forget, 2,000 people die of heart attacks, about 2,000 people every single day, and they're not in the news all the time, and those deaths are needless almost. So the people are dying, you can't live forever. But we don't want people dying in their 60s and 70s for sure. And also, we have the ability with modern nutritional science to live between 95 and 105 years old. We can narrow that bell. Most people should live or die in that window and be able to do that with full mental faculties and full enjoyment of life. And we might as well take advantage of it and have a good life.
Yeah, absolutely.
Yes.
Yeah. Well, pleasure talking to you guys, and also to knowing about you and how great you've done. I'm so proud of you.
And I'm so thankful for you, Dr. Fuhrman, for sharing your message with everybody because it's really an important message, and no time than the present now to start this Nutritarian lifestyle because it's crucial for your health.
Absolutely.
Thank you, Dr. Fuhrman, and congratulations on Eat for Life, your new book. I haven't. I'm excited to read it. And your PBS special, Food is Medicine. You're helping so many people.
Thank you. Thank you so much.